Hello everyone, I am Dr. Chinnababu Sunkavalli. I am a robotic surgical oncologist based out of Hyderabad. Today we'll talk about one important question that comes to your mind is, do you think you can still have children or give birth after cervical cancer? So is it possible to have children for those who are diagnosed to have cervical cancer? Yes, the stage is very important. Early cervical cancer, if we have, there is still a possibility that you can have kids, but the womb in place is usually, you need to understand that whether the pregnancy is possible or not based upon the type of treatment that is done. Sometimes for a very early cervical cancer, a cone biopsy or a large loop excision, so loop excision of the transformation zone, what we call as, so if that is done, it is still possible to have children or you can have kids. So very early stage where just the cone biopsy is done, you can still have your kids. And there is a small increase in the risk of having early birth, or what you call as premature childbirth. So, or the low birth weight is possible in this kind of people. So, another option for early cervical cancer is something called as radical trachelectomy, wherein the cervix is removed and the uterus is still kept in place. So, the upper part of the vagina and the cervix is removed, and they put a permanent stitch around the internal opening of the uterus or the cervix so that it is closed. So these people will, once even if they have babies, they're safe. They can do a safe delivery through cesarean section, and but there is a risk of premature birth or the risk of miscarriage is seen in these people. So one thing is there, stage of cervical cancer which is requiring the radiotherapy. So these people cannot have kids or children because the stage is much higher. So radiation and even chemotherapy for that matter, some of the drugs can even lead to early menopause, and they have their own effect on the ovaries as well. Hence they cannot have children. So occasionally it is possible that the ovaries can be moved out of the radiation field, and sometimes there is a possibility that the wombs are removed and they're stored so that you can have a surrogate pregnancy in the days to come. But in general, this is rare and common, not very common. So the womb can be frozen even before you start the treatment, and then later it can be used for surrogate pregnancy. So it all depends upon the type of treatment, and there is always a risk of miscarriage and premature birth, but still it is possible based upon the stage. Thank you so much for watching this video.